I'm going to sit down with you and I'm going to have a heart to heart with you and tell you why you need this treatment. Why is it that you need to have a full mouth reconstruction or an all-on-4 case or a dent or a crown or a filling or even a scaling and root planing? What was it that got us there? How can we fix it and then prevent it going forward?
This is Growth in Dentistry, a dental intelligence podcast where we ask the question, what does growth in dentistry look like to you? I'm Katie Polson, a dental hygienist and your host.
Welcome to Practice Deep Dive, a special episode of Growth in Dentistry. I'm Katie Polson.
And I'm Adam Smith.
And we are, again, I always say this, we're always excited. I'm always excited, but I am. I'm really excited to be able to talk to our guest today, Jessica Gonzalez. She's an office manager in San Antonio, Texas, at Wurzbach Parkway Family Dental. And I'll introduce her in just a minute, but it's going to be a great episode, so hope you stay tuned. For those of you that are current customers, I wanted to highlight our DI community in your practice growth platform. It's a space where customers can go and chat with each other. If you haven't had a chance to get in there and chat with other people and look at the forums, it's a great place if you want to learn how to use the data that we give to you. So really great place to check that out. Also, if you need another Facebook group to join, does anybody really need another Facebook group to join? If you want to drop one and then join ours, that would be great too. But we go find our Facebook Dental Intelligence Podcast community. It's a fun little group. We'll make sure that that Facebook community gets put in our show notes. And also, if you're not a customer and you've been toying around with the idea of seeing what Dental Intel could do for you in your practice, for those of you listeners to our show, we're giving a $50 gift card for those people that complete a demo. So if you can get that information at get.dentalintel.net/podcast, and that link will be in our show notes as well. So with all that being said, again, Jessica Gonzalez from San Antonio, Texas. She's an office manager, and we are excited to talk to her. For those of you that have never listened to one of these episodes, the goal with them is we have data from over 10,000 plus practices, and we really want to highlight those practices that are doing exceptionally well in our top 10% of data in certain data metrics, and tease out kind of what they're doing right, what they're doing amazing at, really, and hopefully we can learn from them. So, Jessica, welcome to the show.
Thank you. Thank you for having me.
You're welcome. Thank you for taking the time out. Jessica is also a full-time student and an office manager of a very busy practice. So it's a lot.
We really appreciate your time.
Yeah, we really appreciate your time. Yep. So
however I can help others.
That's awesome. Tell us a little bit about how you got into dentistry and how you ended up in the practice that you're at now.
So growing up, I was one of those kids that never really went to the dentist. My parents never had dental insurance. It just wasn't a thing. Going to dentist as often as I should have also wasn't a thing. So I knew that at an early age, I liked going because I had been as a early child, and the dentist never really scared me. I really liked being there. I think I really liked the treasure box, but who doesn't? So I had a gap in my two front teeth that was really large, and I was really self-conscious about it. And so I knew that when I became an adult, I wanted to fix it. I'm one of 5. My parents couldn't afford to get me braces. They were really expensive at the time. So it's just something that didn't happen. I got older, graduated, got a job, and dental was where I knew I wanted to be. I went to school to be a dental assistant, and I did not like being in the back. I quickly realized that part was not for me, but I wanted to be in dental. So I asked for a front desk position and I got it, and I just kind of grew from there. My favorite thing that I like telling people is I went from being someone who wouldn't look you in the eye and was super shy to just, I'm vibrant. I love talking to anybody that I can talk to. I love smiling all the time because I got braces with the first office that I was at, and it just completely kind of changed who I was, and it made me more confident. And I just loved that that's how it made me feel, and that I could do that for so many other people. It was amazing. It's an amazing feeling to help someone who struggles with either issues with their smile, or maybe their hygiene, or they don't even have the knowledge, or I guess given the experience to have a clean smile. And I don't know, just the feeling behind it is what kept me there, and it kept me growing. And I think my passion is what kind of helped me grow so far in a smaller amount of time. I've been in dental now for about a decade, so I love it. I really, really love it. Yeah.
That's awesome.
That's a great story. Thank you for sharing that with us. One of the things that stuck out to me when we talked on the phone earlier was your background in being in the DSO space, or the enterprise space, and now you work for a single location practice. So talk to me a little bit about your, we're not saying either one is better or worse, but talk to me a little bit about the differences, and then how you've kind of been able to apply what you learned where you're at now.
So I worked for a national DSO, and then I worked for a local DSO, it was only Texas wide. I learned a lot from the national DSO in regards to how things are run as a corporation. And I feel like that helped because they offered so much to you. I mean, from marketing things to just educational and growing, and kind of showing you how to grow. Each office with the national DSO I worked for, each office was kind of responsible for itself, in that you got a budget and you had to work it from there. So you learn going from that, taking it to a statewide DSO where I'm not as big, but I still kind of have a lot of the same things. You again pick up how to focus on your new patients, talk to your new patients. Again, there's a lot of learning that goes into your bigger DSOs to your smaller DSO to now being in a private practice. The educational side of things is from me. It's from things that I now, look up, or research, or classes that I take to help me, versus things that were given to me. And implementing things from the bigger national chain to the small one, it still helps. No matter whether you're in a big office or a small office, at the end of the day, your patient care is still always number one. And how you treat your patients is the same across the board. And you just utilizing the tools from each one and implementing it into my now private practice, it's really helped.
Yeah.
That's awesome.
Really great. So let's transition a little bit to talking about
Wurzbach Parkway Family Dental. Tell me a little bit about
that practice, size, kind of demographic, those kind of things.
So we are a single office practice. My doctors are amazing. Our demographic is pretty much anybody who's willing to come in. We don't have a specific, if you want to come in and you want to be treated, we will treat you. We are on the north side of San Antonio, and we get a variety of people because we're also down the street from our city's medical center area. So we get a lot of really diverse people, and it's hard to narrow down just a certain type of demographic. But again, it's just, I don't even know how to explain it. Our practice is very humble. It's very family oriented, very family related. When our patients come in, we treat them as if they are family. One thing we get from a lot of patients is that it doesn't feel like a dental office, that it has a really homey vibe to our practice. And I think a lot of it is because you hear us laughing and joking, and not with each other, but with our patients. Our doctors make it a point to remember things about people, to go above and beyond, just to make our patients really feel comfortable. We have a lot of high anxiety patients that love coming in because, again, we do our best to make sure they're comfortable, they're at ease. And we just treat people we want to be treated, and we hold ourselves to that standard.
That's great.
And how many providers do you have in your practice?
I have two doctors. We just recently brought on a third. We have 3 hygienists and 10 operatories in total, including a surgery suite.
Awesome.
Great. That sounds a lot like my practice that I have, but I don't own it. I pretend like I own it, but I don't. It's my brother.
Oh, I do the same thing.
She makes the decisions.
I do not. Actually.
She's the neck that turns the head.
He does not listen to me at all. But it sounds a lot like the one that we have in Salt Lake City, Utah. Same size, same location, same idea, and the patient demographic seems a lot like it. We're next to a hospital, and so we get a lot of like over like toothaches and stuff like that kind of get and they really are high anxiety people, because if you're going to an emergency room for a toothache, you'd rather not go to the dentist.
It means you probably means you waited a good amount of time to get that taken care of.
Yeah. And how long has the practice been operating?
I laugh actually with that question a lot. I get it pretty often. So my doctor has been practicing as long as I have been alive.
Okay.
He's been around a while.
Yes, he has been practicing for 33 years.
Okay.
That's awesome.
Yes. I remember the day he told me that when he graduated, opened the practice. I thought, so that year sounds really familiar.
Oh,
awesome.
Well, so we're going to talk a little bit about, dive into like
the practice and what you guys are excelling at. And one of those things that we talked about previously was the new patient experience. And the reason why we got into that was you've got your practice is at 90% average on reappointment with hygiene reappointment. So that means that everybody that comes in through hygiene, 90% of them get reappointed, which tells me that people want to come back when they see you guys. So what attributes to that? Talk to me, because I know that your new patient experience is kind of unique in your practice. So talk to me a little bit about.
Our new patient appointment is 2 hours long. We go very in depth in explaining everything from your oral health care to answering any questions that you have. We even do sleep apnea. So we have a CVCT machine that goes over, that shows the constriction in the airway. Not enough people are informed about sleep apnea. So we, as a courtesy, take that CVCT and give and inform all of our patients that we show them, this is what airway looks like. Just kind of going over to be mindful of it, whether or not they take it, at least they're aware and we've brought the subject up. Now, our new patient experience, like I said, is 2 hours long. We bring the patients in, we do an iTero scan. Our hygienist will go in, they'll kind of greet the patient. Again, we want everybody to be comfortable. So we take our time. Again, we like to let the patient know that they're not just there for their cleaning, they're there to meet us, to gain another family in essence. So we take our time making sure that we've answered all questions, maybe get any and all information, all of that, to even our doctors coming in and our doctors, again, reviewing the same information just to make sure that we have a full grasp of what our new patients are looking for. There are times where people come in and like, I went somewhere else out of state or I was in state and they just didn't really listen. And I think listening to your patient is a big thing. One thing I do love about our new patient experience is that it doesn't start when you walk into the office. It actually starts when you call us to schedule the appointment. The moment you call us to schedule the appointment, we have what's called new patient coordinators. So I have 3 specific people, myself included, that are in charge of taking new patient calls. And what we do is we go over with the patient exactly what's about to happen. We tell them, we book their appointment, making sure that it works for their schedule, it's conducive, making sure they're aware they're going to be with us for 2 hours, and also letting them know what to expect next. With Modeno, we send out our new patient paperwork as well as a link to a video with the welcome text messages. And in the video, it again explains what to expect with your new visit and kind of just a broad view of everything. We do everything, including telling our patients that it's cold in our office and they can bring a blanket if they'd like, or a jacket. If not, we have blankets in the office for patients to use. So we really just do go fully in depth, making sure we get all of that information. And again, that's just the phone call. From the phone call, they receive that text message. In the text message, there's the link for the video. From there, patient comes into the office, has their appointment, and even while they're there, they meet multiple people. We like them to see what we're all about, a lot of the times we'll offer a tour to patients. If they arrive early, maybe we usually ask they arrive about 10-15 minutes just to make sure we get them all checked in on time. They arrive, we give them a small tour of the office, showing them everything, chatting with them, making them feel like we're friends, like we're family, building that relationship. That's one thing that we really, really pride ourselves on, is building that relationship. If you build a relationship with your patients, they know that they're not just patients. They are a part of your team. They are a part of your family. From there, we bring our patients back, have them seated, go over everything. On the way out, there's about 4 people that will ask you how your visit went, because we really want to know. We really want to know that everything went okay. We like to, again, joke with our patients, have a good time. There's a laundry list of things that we like to do to make sure that our patients leave not only happy, but knowing that we care and that they're now a part of a family. They're not just a part of a dental clinic.
Yeah, that's really great.
We also do follow-up calls too. So we will call the next day just to ensure that the patient's visit went well. And we'll also follow up about a week out as well, just to see if there's anything else that they need, anything we can help them with. And if they didn't make an appointment when they left for their hygiene, we'll try and schedule that appointment the next day and then try and schedule them that week if they don't have one. If not, then we just call again just to see if there's anything else that we can help with, is there anything else that they need.
That's awesome.
So for people watching this, if you've watched the last 5 episodes that we've done that are similar to this, there was no planning involved in like people saying this same thing about new patient appointments. This is we've done 2 of these today. You'll see them several weeks apart, but both have said they take specific emphasis, brought up iTero scanners, all the imaging, intraoral pictures, and that they spend additional time for the new patient visit. The office tours have been mentioned in both. Both have interestingly mentioned it starts before the new patient visit with the first phone call, how they explain how important the first new patient visit is. So it's this theme is not because like we chose people that really loved the new patient visit. This theme is we actually looked at, okay, this practice is doing really well here, but all of these practices are actually doing really well across the board. If we look at reappointment, if we look at collections, if we look at case acceptance, if we look at production per visit, production per year per patient, they're all doing very, very exceptionally, top 5 to 10% of any practice that we have on our software. And they've all brought up this same thing. It's really been eye-opening for me, because a lot of practices don't take that time.
Yeah, so 2 hours, hour and a half, that's not common. And also even just, I love the idea of the new patient coordinator. I know that you said that was kind of a newer thing in your practice. Like, I mean, you just implemented it a little while ago. Tell me about what that looked like before you implemented it and what the changes that you've seen in that role, because it's pretty specific.
So before, everybody was allowed to take a new patient call, which isn't a problem. It more so was to set a little bit more structure. I love structure. I like everything to be organized and in its place. It's just how I like things to be. And, we keep track. We keep very, very, very detailed notes on our new patients. We have a spreadsheet on all of the new patients that we get, any notes with those new patients, which doctor they went to, how they were referred to us. And when you have less hands in the pot, that helps too, because there is an issue with the new patient call. I know now that it's either my insurance coordinator, my hygiene coordinator, or myself. I think it's important in an office for people to wear a lot of hats, and having these people also wear the new patient coordinator hat helps, because, for instance, my hygiene coordinator, she specifically focuses on our hygiene patients, make sure again that they're happy, that they're scheduled, and that they're taken care of. My insurance coordinator makes sure that the insurance side of things are all taken care of for the patient, making sure that their benefits are verified. If they have any additional copays, I know you'll come up plan every once in a while that says you have a certain copay every visit. When you get those, we want to make sure our patients are aware. If we're in or out of network, again, we want to make sure our patients are fully aware before they come in. No one likes to be surprised, so we like to be as transparent as possible. So if something were to arise, I'm the office manager. If something happens, it comes to me, right? So I know that between the three of us, our patients are taken care of specific to our duties as well. So it kind of has less hands in the pot, adds a little bit more structure. And I know when we're focused on tracking our new patients, that again, it's less people adding in, meaning there's less room for error. And the less errors we have, the happier our patient are.
Yeah. It's just, to ask someone for 2 hours of their time for a new patient experience, I'm sure that you have to set the right expectations on the phone. And so it makes sense to me that you would limit that to the certain amount of people in your practice so that they can communicate that effectively, as opposed to just training everyone to take those calls.
I kind of what John was, again, as I mentioned, the new patient visit doesn't start when you come in. It does start on the phone. And I think the first step to that is thank you for calling Wurzbach Parkway Family Dental. Thank you for calling X Dental Practice. I think thanking your patient at the beginning is also a factor because, as you know, there are so many dental offices and so many dental practices, both in my city and I'm sure across the country, that they could have chose from, and instead they called your practice. They chose your practice. And I think it's important to start right at the beginning by saying, thank you for calling.
Yeah, that's really, really great. And I love the idea of that video and using Modento to send a video link. It's such a good idea to kind of give people an idea, because people make purchasing decisions totally different now than they used to. So more than likely, before they even got on the phone to make an appointment, they looked at you online already. They've looked at your social media, they've looked at your Google reviews, and it's just one more thing to solidify, okay, yeah, I made the right decision in choosing to call them. We've talked about this before, where Google reviews, which we might get to in talking to you about, but now everyone has really great Google reviews. Sometimes it's hard to tell who to call because everyone's got great Google reviews. Not everyone, but
there are a lot of, if there's a lot of competition in the city, there are a lot of options to choose from.
So if somebody
high
chose
number
you,
of Google reviews.
if somebody chose you to send them a little video to reinstate, you've chosen the right place. And here's one more thing that maybe you didn't see when you stalked us before. Yeah. I love that idea.
Honestly, I contribute a lot of it to Modeno, making it easier for us to contact our patients. These days, everybody's got a busy schedule. I'm a full-time student and I work full-time. When I get something from a doctor's office in text message, it's so much easier. And then now that, we could send that link included with it, it's just made so much easier. And especially if I have a patient that, you're right, it's not always easy to tell somebody, our new patient appointment's 2 hours. I think giving that proper verbiage and saying, you know what, I'm also going to send you a video explaining your new patient appointment. It helps ease them as well.
Yeah.
Really great.
Definitely.
Anything else before I wanted to talk to you about your annual patient value, because annual patient value is a metric that we track in dental intel that tells us on average what it says. What is your annual patient value on average?
It's an interesting
metric
for how your patient experience overall is, because it factors in a lot of things. Your patient value is going to decrease. Your annual patient value is going to decrease if you don't have people coming back because they just get one visit a year, or your annual patient value is going to decrease if you have bad case acceptance because they're not doing the treatment you're asking them to do.
Right.
So there's a lot of factors that go into it. So it's a really interesting number to determine kind of the overall health of, do people trust us? Are they coming back? am I in line here, right? Or are my fees really bad? Do I need to work on that? Do I need to drop out of some insurance networks? All of those things are factored into this annual patient value. So
Yeah, this number also tells me a lot about like, are we working? It's such a cliche phrase, but are we working smarter and not harder, right? Like how much?
Oh, that's my favorite phrase. No, that's my favorite phrase. Cliche or not, if you were working harder and not smarter, you were in the wrong place for me.
Yeah. So I feel like that metric really helps us to tell like how much value is happening with each single patient instead of trying to bring in a ton of new patients at a lower value. So anyway, your goal, I guess, is $800 for this, but which is high in general, but right now your annual patient value is $1,300, which is so $1,300 per patient, which is really high.
It's one of the highest I've seen.
Like it's really high. And I guess kind of want to like talk to you a little bit about that, because obviously it's case acceptance has a lot to do with it. If they feel good in your practice and they have a great new patient experience and they trust you, then they're going to accept the treatment. But I also love that your doctor has been working for over 30 years. He has CBCT.
Yeah. You
You
also mentioned you see all different types of patients,
Yeah.
right? So it's not like we only accept very well off patients, right?
Yeah, exactly.
No.
So
with an annual patient, the value that high, you'd think it would be
fee for
cosmetic
service,
or
very
implant.
cosmetic.
Yeah.
So-
So dig into it.
And one other piece is some people watching might be like, "Ooh, they're overdiagnosing," and that's not the case, because you're also not diagnosing to a point that you're making anyone that we can see through numbers not come back. You have very, very good retention as well.
Right.
So it's not like we're really pushy. It's just things are going very well. Obviously, you probably do have a mixture of higher dollar procedures in there. Otherwise, you probably couldn't get to that number. But overall, there's nothing that I can pinpoint and say, oh yeah, they're very aggressively diagnosing, because none of the other numbers that would typically be indicators of people being aggressive are red flags. It's really very healthy all around, plus this number that's just very high. So that's why we want to dig into it.
So I think it's because we're a one-stop shop. These days it's all about convenience. We've got DoorDash, Eats. They make a lot of money off of our company, by the way, with my staff. But I think that it's all about, convenience, and we are a one-stop shop. On top of that, we do a lot of patient education. I'm not going to tell you what you need. I'm going to tell you, I am going to tell you what you need, but I'm mostly going to focus on why you need it. I'm not going to tell you need a crown when you don't need a crown. I'm not going to tell you that you need fillings if you don't need fillings. Unfortunately, I've had the experience of meeting some of those people will overdiagnose just because it's all about the dollar, not the patient. And that's not, in my opinion, that's never okay. I don't care who you are. It's just not, the patient and the patient care is who needs to come first. And that's what we do, is we focus on that. And we're actually not really pushy with our patients either. We take more of a family approach. And again, I'm going to sit down with you and I'm going to have a heart to heart with you and tell you why you need this treatment. Why is it that you need to have a full mouth reconstruction, or an all-on-4 case, or a dent, or a crown, or a filling, or even a scaling and root planing? What was it that got us there? How can we fix it and then prevent it going forward? My hygienist once told me, and I think this speaks to how our practice is. She said, when I have scaling and root planing patients and they come back and they're not any better, I take it personally. She says, because I feel like it's my fault that I did something wrong. I didn't educate them enough. I didn't show them enough. I didn't explain enough. And I feel like it's my fault. And that's exactly how I think as a staff, we feel, if we have a repetitive patient who's coming in for fillings, it's okay. What are we not telling you? What are we not teaching you? What are we not showing you? So if I can educate you enough where if I can educate you enough where you're going to understand why you need this treatment, and if you want it and you want to do it with us, great. I hope that you want to do it with us, but I'm also not going to be pushy to where, oh, you need this crown, this is your cost.
Yeah.
Let me know when we can schedule you. It's not how it works. You really have to educate someone as to why they need to make those purchases. And, some of them aren't, just a couple $100 or a couple of dollars in general,
based off of your annual patient value,
pricey.
I'm sure that you have a lot of high cases that you are presenting. Yeah. So
we do. Our doctors, whether it be a new patient, whether it be a returning patient, they really sit down and explain why the patient needs that treatment. We have a surgical suite on site, and if we have a surgery that's needed, Dr. Walters is she's who does a lot of them, and she's amazing. I mean, I could sit and listen to her talk to patients all day long. She really is. Dr. Klinke, who is my male doctor, he is the same way. He does most of our endo, and listening to him talk to patients and explain, just show you see and feel how much they truly care. And I think that's really what patients are very receptive to. And the fact that our staff really does work as a team in explaining that to patients, answering any questions that they have, relaying the information, from the doctor to the dental assistant, from the dental assistant to the patient coordinator, to the treatment coordinator, and then again, reiterating it as to why, all of us being on the same page, all of us knowing why the patient needs it, and explaining it is really what it is. All of our rooms actually have TVs where we can bring up x-rays, IOs, and show our patients what exactly they're looking at. One thing I really like about the iTero, and some people know this, some people don't, is that on the iTero, you can actually show someone the decay. You can show them where the decay was previously, and you can show them where it's been at 6 months from the original time. And, patients seeing that for themselves, I think it's also an eye opener, and it helps too.
Yeah.
Yeah, I was going to say, you didn't mention this, but I'm willing to put money on the fact that in the 2-hour new patient appointment, you spend a lot of time not only painting a picture for the patient of where they're at, but also understanding where they want to get to. And I think that's a piece that a lot of, when we do a typical 1 hour for cleaning and new patient exam, you don't have the time to do that. You don't have the time to
putting out the fires.
You may have the time to diagnose whatever is there, but you don't have the time to get to know the patient well enough to know that, hey, I am self-conscious of my smile. I sometimes choose not to smile because I'm worried about how it looks, right? Or, understanding those things is not something that comes up in the amount of time that you give yourself in a 1 hour new patient appointment to get a cleaning and an exam done.
Yeah.
So
yes, usually again, in the DSOs that I worked for, that was very common. You had an hour, and it was really eye-opening when I came on and they said it was 2 hours.
Mm-hmm.
I was kind of opposed to it. I'm not going to lie to you. At first, I thought to myself, who has that kind of time?
This is why it's been a shock to us, is because I've worked in a practice where I did an hour. I mean, they still do it. We have an hour for hygiene, new patient hygiene appointments. And it's been kind of like a case study almost for us to go through all of these, to realize that it kind of flies in the face of everything that I would have thought. I mean, if you told me I had to do 2 hour new patient, I'd be like, no, I'm good, thanks. So now I'm like changing my tune on it. I totally am, because
my doctors are really good about researching everything. The reason that we have a lot of protocols in place is because they've done the research on them, and it's amazing the outcomes that really come from that research. And that's one of my favorite things about being here, is that to them, they're not just treating patients. They're treating their own family members. Think about it. If you ever have a family member that gets any kind of illness, what's probably the first thing you do? You do some research on it, right? You want to know more about it, about what's going on, about what the options are. My doctors take that time, their own time at that, after work, after hours, to research what's the best way to care for their patients, how to make them feel like family. And I think we all kind of have. I've seen my staff actually look at certain verbiage. I catch things, and for me, I try to avoid negative. I like positives. Financing with patients can be hard if you don't offer an in-house finance, and a lot of DSOs do, versus smaller practices where we use different finance companies, Care Credit, Lending Club, so on and so forth. There's a bunch of different companies, WiseTac. There's a bunch that you can use. So rather than telling a patient, well, I don't in-house finance, but I do others, I say, yes, we finance. These are your options.
Yeah.
So it's always a yes. And I think when I'm training my staff, it's the same thing. If they tell somebody something, or if I realize that it maybe could have been worded a little differently, I tell them, how could you have said that? And they'll look it up themselves and figure out and come back and say, you know what, this is what I'm going to use next time.
Yeah.
And I think it's great.
I want to back up just a little bit before we move on to what you're talking about, is with the annual patient value being so high. I kept thinking, your practices really set themselves up really well for having doctors who specialize. So I'm putting that in air quotes for those of you that are just listening, but every dentist, this is one of my favorite questions to actually ask, because it tells me what kind of dentist they are. What do you love to do? My dad was like, he could do endo, core, crown every day of his life. And my brother's a huge surgical guy. So like dentists like to do and they like to go to work doing the things that they like to do. You know what I mean? They would love a day full of whatever it is that they love to do. So, it's pretty great that you guys have matched yourselves with people that are good and feel good about being able to give that care. Like you said, you guys are kind of a one-stop shop, and the fact that they've taken the time to continue to learn and be able to feel confident to be able to do that in your practice. That's a really big thing. And that takes time. That takes
Yes.
years of training and higher education and continuing education. And so some of that, and you can't listen to this podcast and then change it tomorrow. Like some of it needs to, it takes time.
Yes.
Yeah, for real. But that being said, the one thing that you can do and change is, I think that makes a big difference with your annual patient value, is the fact that you guys offer financing. And I know that's not for every practice, but like you said, with the companies that are available now, we're biased to WiseTac because that's who we integrate and partner with in Modento, but it makes it so much easier, and you're hands off, and then you're using a third party, and then you can have an annual patient value that this high, because those cases are really high, like dollars amounts for some people. Like they can't afford, not the Joe off the street can't afford, $15,000 in a new whatever it is. So
Yes.
I would imagine that a lot of that, if we looked at it, is related to the fact that you guys offer external financing too.
How often does that come up? Just out of curiosity.
The financing.
Yeah.
Yeah.
Mhm.
Well, I would say probably about 50%. We run a 50-50 ratio,
Okay.
I would say a vast majority of our patients do have insurance. So for just their out-of-pocket portion, sometimes it works out really well for them. Sometimes they do need financing. I like that we do offer multiple options because, as you know, different lenders have different criteria.
Yeah.
Mhm.
So we try to help everybody the best that we can.
Yeah, it's really
That's
great.
awesome.
Okay. Anything else on that topic?
Just going back to that, having that annual patient value with, 50% of people needing that in-house or
Financing.
the financing. I know a lot of dentists shy away from that because sometimes they lose a little bit off the top when that happens, but
Right.
clearly the trade-off is worthwhile. So
Yeah.
It is. I mean, again, I think at the day it's about taking care of your patient. And
Yep.
if unfortunately it means that, then,
Yeah.
you know, you
Yeah.
helped your patient at the end of the day. And if I can go home and sleep at night, I'm great. If I can't sleep at night, we got a problem.
yeah, that's awesome.
So one of the things that I want to talk about before we close today is your use of, I know that you are a user of Swell
Yes.
with Medento, but also like your marketing and the way that you've gained reviews. Because although I feel like there's a lot of people talking about Google reviews, it's been like a thing for a long time, but
Mhm.
it's interesting to hear how people have, if new patient acquisition is something that really you're interested in, tell us a little bit about how you guys have been successful at doing that.
So as you mentioned, we do use Swell. Swell has been a really big asset as well. On top of that, in each operatory, I have created QR codes, and it says on it's a little, I don't know, maybe the size of my cell phone. It's a little thing like this big.
Mm-hmm.
Yes, I'm sorry, pink is my favorite color. So this big, maybe, I don't know, what is that, like 3x5?
Mm-hmm.
3x5 inches, and it's a little card in each operatory, and it's got how did we do today? You know, how was your visit? Scan here, leave us a Google review when you can. You know, I think that's big. And then two, we ask, you know, it's how was your visit? Was it great? Great. You know, if you leave us a Google review, we'd greatly appreciate it. You know, not forcing it, but just mentioning it. And I think that just throwing it in there is a good way. But I do think that your patient has a great experience. They want to tell the world. Our biggest form of referrals every single month, hands down, is word of mouth.
Yeah. So
And
tell me a
so-
little bit. I mean, obviously, we've asked this before from other practices. Do you incentivize for word of mouth? Like, when someone
Yes.
refers? Yeah. What does
we
that
do,
look like?
We do. So for us, it's just whitening trays, and they're not the take home with the syringe. It's literally just a 4-pack of whitening trays.
Opal Go, whatever.
Yeah.
Not to name
That's
drop,
just-
but they are in Utah. So
Yes, actually, yes, it is. It is the Opal Go, and it's not one of those that if you were somebody, we'll give you an Opal Go. It's thank you for the referral. Here's an Opal Go, because
Right.
by then they've already referred it to us, and they're like, oh, great, you know,
thank you. Yeah. Got it. And
That's awesome.
yeah, I think the other thing, I mean, the practice has been there for quite some time now. And I know that the doctors have like really kind of integrated into the community and the culture, and that's probably part of the success. So talk to me a little bit about what that looks like. Do you guys do any like community outreach or anything like that?
We do. So we have what we call our internal marketing team, and it's we have one person who is in charge of finding events for us to contribute to, whether it be we did the oral cancer walk, you know, most dentists do. On top of that, you know, we've got a food bank coming up. We we also help with another company that does a few fundraisers for the local battered women's shelter. We like to fundraise for that too. I don't know what it's like where you guys are at, but I know here our food bank is struggling a little. So, you know, just raising where we can to help where we can, you know, whether it be something small, something big. And I love that our patients are so committed as well. You know, we just put a post on Facebook and we get a flood of items. You know, I believe it was last December, we put out that post about sending items out of women's shelter, and before I knew it, I had people coming in left and right with donations. I had actually just put out a wagon, not really knowing how well it would go, and I definitely needed more than the wagon. We had a lot of things come in, and I just loved that it's not only us, it's our patient. You know, we care. I think it's that we care so much about our patients that our patients care so much about
Yeah.
everybody, you know?
I love that you extend that to your patients. A lot of times with community outreach, it's just like the practice and like a few people that will continue to like be willing to do that, like when you're not in the office. But I love that you extend the opportunity to serve the community to your patients. It's really great.
No, it's like, it really is, you know, friends and family with our patients, you know. I have a few patients that every time they come to the office, we joke for 10, 20 minutes before they even go back or when they're done, you know, just about different things. I have
And
one
the hygienist
patient,
is like, come on, Jessica, I'm running
she
late.
is. She's like, Jess, come on, it's time. I'm like, I'm sorry, we got caught. And it's, you know, I have one patient I love when he comes in, every time he comes, got a cat video for me. And they're so funny. But, you know, it's relationships like that. You know, I have
Yeah.
another one that comes in, and every time she comes in, she's got new music to show me. And not that she's creative, but recommendations that she's got. And
Oh,
again, it's that we're friends, we're family, you
yeah,
know,
that's really great.
I
getting
want to
them
go.
involved with us.
I want to just go back a couple steps here. You mentioned about 50% coming from referrals of your new patients. Can you put like an approximate volume on that? Like how many new patient referrals you're getting a month?
In total, or just the word of mouth?
Yeah, word of mouth. Sorry.
Oh, so like a number or percentage rate, because it is
Just
different. from
yeah,
us.
number. Just a ballpark.
So if I have, let me see, I'm trying to think of what's the previous month. So if I have 60 new patients that month, I would say a good 45 of them were word of mouth.
Okay.
And that's, and again, it may actually be a little lower. That may be an exaggeration. I would be 35 of them would be
okay.
word of mouth.
Even then, that's amazing. And I think most dentists would love to be there. And the fact that you're not like putting an incentive behind it speaks volumes to the patient experience that's happening in your office. You are putting an incentive after the fact, but not like, hey, send us a friend and we'll send you $100, right? But just as a thank you. So that's amazing. And like I said, I think most people would love to be there. Most dentists would love to be there. And it speaks to the time that you're investing with patients, the relationships that you're building with patients, also the fact that even while attaining an amazing patient value per year, your patients love you. They have no like, you took all my money, ill will towards you. So that's awesome.
It's really my doctors, my staff. I feel like it's a big team effort. I think when you have a team that is as amazing as ours and works well together and communicates and just does everything that they, I guess, need to, it just kind of, the puzzle pieces all kind of fall in. The other day, great example, somebody caught that our new patient, it was her birthday. So we all signed a card for her birthday, brand new visit, and we helped celebrate her birthday with her.
Oh, that's awesome. So nice. Oh, I want to be a new patient in your practice.
Come on, we'll take you.
Oh man,
I actually do have patients. I have one who flies in from New York, and she sees us when she's in town. I have some from the surrounding areas of Texas that come in specifically to see us. So I have dedicated patients for sure.
That's great.
Well, it's been a really fast hour, and we're so grateful that you're able to take the time out of your busy schedule to join us. It's been wonderful. I want to ask the last question that we ask everybody on our podcast, which is, what does growth in dentistry mean to you? Because it can mean so many different things to so many different people. Oh, we didn't say Jessica's studying software engineering, and so this is really interesting. She's got an interesting background, and I'm interested to hear what it means to her.
So I do think that technology really is kind of where what growth in dentistry means. You know, again, patient education is a big thing for me, and I think when you can help educate patients, whether it be through AI or just things that are coming up, or with iTero, the IO picks, showing them on the screen their X-rays. I think technology is, but how do you put it? growth in dental, I think is what it is. So I'm excited. I'm very, very excited. I hope to be part of that growth and part of that one day. I am hoping to use my background in dental and helping technology to grow, to help the dental field grow overall. Again, whether it be diagnosis or in education, I just want to be able to help people.
That's
So
awesome.
I think that's where it's at.
Well, I think you will. I think you'll get there.
We're confident you'll be
Yep,
there,
yep.
Jessica.
Thanks.
Well, it's been awesome. Thank you so much. This has been
Thank
Growth in
you.
Dentistry, a dental intelligence podcast. Special thanks again to Jessica from Wurzbach Parkway Family Dental. You can find the link to our demo or also our Facebook page on our show notes. Thank you to our marketing department for all their work on this podcast. I'm Katie Polson. Keep growing.